Hello, everyone. Um, Excellent. Patient Advocate Foundation, just want to take a second to introduce Patient Advocate Foundation as well. And thank you guys all for being here and listening to me. Patient Advocate Foundation is a national 501c3 organization that provides case management services and financial aid to patients with chronic, life-threatening, and debilitating illnesses. Since our inception in 1996, PAF has provided direct, sustained patient assistance to more than 2 million patients and touched millions more with lives through our websites, online chat, and outreach events. At Patient Advocate Foundation, we are centered around caring for the patient and helping them through to overcome a range of access barriers and assist patients so they can focus on getting well and staying well. For almost 30 years, PAF has been provided sustained case management services and financial assistance to patients who are facing healthcare access issues. And PAF has been on the front lines helping patients with a wide range of access and affordability issues. Here you can see the experience that we had just in 2023 alone. And one of the things that we pride ourselves on is because we're helping with access issues, there is a universal time where we can serve any chronic, debilitating, life-threatening disease. We were able to serve 958 different distinct diagnoses, and 582 of those were rare diseases. What we do from that point is we actually aggregate the individual experiences, and our Patient Insight Institute works to take all of those individual experiences and bring them into a compelling scientific narrative to actually take that and work at the state and federal level to bring it to the public and show medical professionals what is going on with patients and drive access for those patients. In this vein, we actually have, and I'm presenting for the first time, our Medicare financial burden survey that we did and learning about what patients are experiencing within the IRA. So to introduce this, and this is probably not going to be things that you guys haven't already heard in your own individual experiences, but this is really kind of a call to arms for the patients that we are working for. And as we all know, unexpected expenses can impact anyone at any time. And unfortunately, with the environment that we're currently in, with inflation and other factors, it is at a time where 1 in 4 Americans lack the ability to cover even a $400 emergency expense. 63% of U.S. adults say that inflation is causing them to save less for unexpected expenses, with 1 in 4 having no emergency savings whatsoever. About half of U.S. adults say it's difficult to afford healthcare costs, and 1 in 4 U.S. adults stated that they or a family member had problems paying for healthcare in the past 12 months. Healthcare expenses are steadily increasing with a larger proportion of this cost shifting to the patient for coverage. The inflationary environment in the U.S. has drastically increased the cost of daily living expenses, and most Medicare covered patients exist on limited fixed income. And as we know with the IRA, they're currently looking at $3,300 and the elimination of the 5% cost share in catastrophic stage, which will be shifting to $2,000 in 2025. So this is the methodology of what we did here. You can see who we engaged with, and we're talking about. This is actually from May of 2024, and the most often reported were HIV/AIDS patients, about 36%, and then cancer patients at 19%. And from the demographics, you can see we actually are talking about an income level of less than $50,000 per year. About half were from the South, and 17% were rural patients, and about 88% of them were 56 or older. And the survey respondents had the ability to select from 9 different Medicare or Medicare Advantage plans. For the survey, we used the option based on those from the Kaiser Family Foundation. Based on the responses, we had about 42% that were Medicare Advantage plan, and 39 were traditional Part D. As you can see here, for the federal poverty level, 91% of patients responding to the survey had a household of 1 or 2 people in the household. And breaking down to the poverty level, in this survey, 96 out of 100 people were at or below 400, and 59% were below 200. Primary sources of household income, 91% were all on fixed government payment sources of either disability at 33% or Social Security at 58%. And then as secondary sources of income, we did have 43% said that they did not have any secondary sources of income. 57 did have that. They reported that either investments or their 401k or their full-time or part-time employment. And to round out the percentages, we actually had a third that was friends and family, consisted of about 14% of patients that said that their secondary household income was help from friends or family. And then looking at the cost breakdown across these monthly costs, we actually had we already established that they have a household income of less than $50,000. We wanted to explore how much of that income was spent on their care. The first healthcare related expense we asked them about was the monthly amount that they spent directly on provider costs. Patients were able to select a specific dollar amount, and then you can see here that the median was $150, but we did have some outliers that went as high as $1,100 per month in direct provider costs. As far as the pharmacy costs, again, that was quite a wide spread. We specifically asked as it related to their prescription medications. Again, patients had the ability to provide an exact monthly amount. The average was around $100 spent on prescription medications, with the vast majority spending $140 or less. And then you can see again there were some outliers with costs as high as $1,120. Finally, we want to know how much patients spent monthly on their health insurance premiums, primary, secondary, and supplemental as applicable. Like the provider costs and prescription costs, they were allowed to give us a specific amount, and the average was right at $200 a month for their health insurance premiums. This is the one that probably is not going to be a surprise to anyone, but is definitely the hardest hitting. On the left side of the slide, you can see the insurance premiums, the pharmacy prescriptions, and the provider care. And we asked the patients if they had a change in the last 12 months of what costs they were experiencing there. And as you can see from the graphic on the left, most of the patients experienced an increase in these costs or remaining stable. Very few were reduced. Health insurance premiums appeared to have the most change, with 70% reporting an annual increase. On the right side of the slide is actually comparing with the patients reporting of their household income and if there was any change. And you can see about 50% said that there was no increase in their household income. So obviously they are enduring more costs with the same amount of income going. To manage that increased cost of care, we wanted to know how the patients were dealing with that. at least 93% of the patients that we surveyed reported that they did have at least one way that they were coping with their changings. The ways that were still positive for their treatments and for their medications were 57% received charitable copay, 33% added debt to their credit card, and 26% changed their lifestyle, what they were spending on other items, non-medical items. Then it came to the changes that have actually affected their treatments, which 23% delayed their care, didn't go to the doctor when they knew they needed to, didn't go to the emergency room, etc. 20% cut their supportive medications, the non-essential medications that they were taking, and 19 switched their medication types to something that was suboptimal or at least different. And then with these kind of conversations, in addition to asking them about their healthcare-related cost changes in the past 12 months, we also ask about whether or not they anticipated their costs rising next year. Almost 70% of patients are expecting to spend more of their annual income in healthcare in 2025. And when asked what financial point these increases would cause financial distress, over 2/3 reported that an additional $100 monthly would be more than they could bear, their kind of financial tipping point, if you will. Specifically, 38% of patients indicated that they were already financially stressed and that a change as small as $40 would put a significant strain on their budgets. Since many of the provisions in the IRA are geared towards limiting patients' out-of-pocket prescription costs, we wanted to better understand how patients would tackle covering their medical versus their non-medical expenditures. We provided patients with the following prompt of: during times of financial stress, patients often change the way they are filling or taking their prescriptions, either by delaying their prescriptions, cutting pills in half, or stopping some medications altogether. And they were asked would they do these things? And as you can see here, 58% said that they would make difficult decisions and cut out other parts of their budgets so that they would not have to do this. Now the 42% who indicated that they would prompt changing medication adherence behaviors, we went a step further and asked them to share with us a specific monthly dollar amount that would prompt them to make this change. On average, a $100 change would be difficult for them to cover and would cause them to consider delaying prescriptions, cutting pills, or stopping medications altogether. And I wanted to go ahead and show you some of the words and their own words on how cost increases to their care would impact how they seek or adhere to treatment. Here's a few of the open-ended responses that we got. These are probably stories and things that you hear from your own patients that you're advocating for now, but just wanted to share a few that we got. Another question that we asked was medication financial support, and 76% of the patients surveyed reported that they had received financial support to help cover the cost of their medications. This could be copay, this could be our program, or it could be patient assistance programs. And so we then took the next step and asked if the charitable and other support systems for patients disappeared, what would what would it mean to them? And you can see here that there are various degrees of stress, very stressful answers, unfortunately. And then one of the ones that hit me the hardest was the quote that this patient returned with I have not given up on trying to find manageable solutions for the incurable medical problems that I have. Yet sometimes I do wonder how much longer I can withstand the financial pressures which haven't subsided ever, only intensified. And I think that kind of, I know for me that's definitely the vibe that I feel from the patients that I have talked to, and I know you guys are experiencing the same thing. And so with that, I wanted to kind of give some final thoughts, and then we can head off to the ribbon cutting and the cocktail hour. But really, it's a lot of what we're doing here, and this is just kind of a call to arms with the work that we do here, we do every day, and bringing us all together to be able to talk through this. It really is a tough time, and getting tougher for patients, and it's something that's so important that we're here and doing. So thank you to every one of you guys out there, bringing advocacy to these patients and helping them through these situations. So the thoughts that are, while the IRA offers promising change to reduce healthcare expenses for Medicare patients, our survey indicates that many patients may continue to face financial hardships. Our survey data suggests the need for continued targeted interventions that we're doing, the enhanced support systems to address gaps in the financial relief to ensure all Medicare patients that can access and afford essential health care. And patients need our help now more than ever, and the reality of reduced costs seems to be the majority of Medicare patients are paying more for less coverage. This additional need we've observed it comes while many of their patient assistance resources are unfortunately being cut. So again, it's us and our work that we're doing each day that are going to bring them through this, and thank you so much for all that you're doing. To you guys too. Appreciate that.
Are there any questions? Oh, I'm coming. I see ya.
Hi, my name's Ann Llewellyn. I'm from South Florida. And I think we talked last year at the conference, but you have been around Patient Advocate Foundation for a long time, and I'm sure you've seen so much. Like, are you collecting data and giving it to Congress or to legislators so they really get the picture?
Yeah, we have a sister organization called National Patient Advocate Foundation, and that is we have through different storytelling and different works that we're doing there. We do have that, and those are the team that both take the collected information that we have with our patient experience through the patients that we assist, and also the stories that they collect to take those to the state and federal level and have those conversations and try and bring the voice of patients into those conversations, because a lot of times when it's a closed door conversation, it's all about kind of the money and those pieces. When you bring the patients in and their voice and everything, as you guys well know, that's when the lights get shed on what the experience is, how meaningful it is that we can actually do these things for patients and help them.
Yeah, because we've heard over the past couple days, or today, that we're the richest country in the world with the money, and can we do better? I mean, really, it seems like we can do better than what we're doing. We're all in this because we believe in it, but it really gets tough sometimes.
Yeah, it's a conversation that Fran, who was earlier on the stage, and I have in the office. It's we will be the happiest unemployed people in the world when it all gets figured out. But until that time, we're going to do everything we can for patients and make sure that they get access to what they need. Thank you.
I was curious because most of your respondents were male, and from what I've read, it's females that often give up taking medication or forego that for sake of the family. So did you look at any reasons maybe why most respondents were male?
I think it was a product of where we were surveying, in more so than anything else. And I do agree that a more balanced survey would bring probably more to that. But yes, I have seen the trend anecdotally that you're speaking of too, and it just was a product of this particular survey and the timing in May that we got the respondents we did.
So it's probably worse than the results show.
Yeah, if that's possible, yes, I would agree.
Any other questions? All right. Well, thank you so much, Alan.
Thank you.
Yeah.
Please stop by booth 314 and we can continue the conversation. Thank you, guys.